maybe it is time to call out this oppressive, discriminatory, systemic approach that sees midwives constantly, almost conclusively, marginalized.
We need to think about making sure that midwives that are in the community that are maybe outside some of the government financing schemes for health get integrated into that. So whether it's around universal healthcare coverage, are midwives accredited and certified to be part of universal healthcare coverage financing schemes? That's one of the things that we have to do. I think the other place for investment is in the pipeline and in the training. And again, that's another place where private sector can play a big role.
I wish we can open our eyes as investment, as governments, as investors, as people interested in ensuring that maternal newborn health really changes across board and really see where is it needed. But we will not be able to achieve much if we are not involving the people who are the key players, the people who are really supposed to be there, the midwives themselves, in the leadership positions, in decision making, as advocates of patients, but also involving the real data, the real realities and lived experiences of the users of that care, and those are the mothers. So I think we need that intersectionality from communities all across board to the frontline health workers who are the midwives themselves, to the decision makers on the policy side, to come together, including other players, including civil society groups and investors and donors and the like, and the development community, to really see to it that we look at it holistically, not in piecemeals.
And I always tell the midwives that I work with that, your work, if you can show through your work that you're providing quality care, you will advocate for yourself. So I think that's a really big part of it, but training is very important. And as we saw in the State of the World Midwifery report, working environments are really important as well. And I think whenever we talk about resilience, which I think we talk about a little bit more in a bit, but is that our expectation is that midwives will perform. There are a cadre of health workers that I think are just expected to do well, even when they aren't provided things that they need to do well. And I think for them to actually be health workers that make a difference, we have to give them the enabling environment that they require. Thank you.
The first is that we have to teach people and raise awareness, especially among policymakers, that midwifery is not just about pregnancy. Midwives can provide 80 to 90% of all reproductive healthcare services for women across their lifespan. And when policymakers realize that is, it's a very economical and it's a very good investment to invest in midwives. We tend to have this picture of midwives only being for pregnant women and little babies, but it's so much more, especially in the world that we're living in right now, where we're having such a backlash against abortion rights and other access to sexual and reproductive health rights. Investing in midwives is more than just investing in healthy mothers and healthy babies. It's investing in healthy communities and women's rights to decide what they're going to do with their bodies.
Midwifery as a model of care is very sustainable. So, I link this to some of the things that we discussed earlier, even about the climate crisis and about COVID. So we've seen, so if I come back to COVID a little bit, we'll say that, as we seen in the State of the World's Midwifery report as well, that COVID-19 has had this impact on midwives and the women newborn communities that they care for. So despite the risks of working during the pandemic, midwives continued to provide care. So even when centralized healthcare services failed, midwifery continued, right? So midwifery, as we know it and understand it, is an economic, social, and environmentally sustainable model. When you talk about climate crisis, it's sustainable environmentally, it's a cost-effective model, and it's a socially acceptable model as well. So I think there's a need to determine what sustainability in healthcare means and how to scale up sustainable models of healthcare.
So when we talk about, why are midwives oftentimes so relegated to the end of the healthcare system, it's because midwives have a lot of power, because they empower women to make choices about their reproductive health and make choices about their bodies. And that, in the systems that we currently live in many settings, that's quite dangerous. And it's a danger to the status quo. That's in that sense. But midwives really are a solution that we need to be using for the climate, for gender equality, for upholding women's rights, and for sustaining communities that live on islands, communities that are rural, or communities that are dislocated. And talking to policymakers about how midwifery can be a really good solution for many of those things, if it's well integrated into the healthcare system, really is key.
I think we need to really look at restructuring and looking at midwifery as an autonomous, fully fledged profession that is really critical for us to attain the Sustainable Development Goals and the like. That said, I would also want to say that it's important that we listen to what the midwives themselves have to say if changes are really to take place. I would really keep on insisting on the need for us to really listen to these people, because if we talk to them, and I'll speak to what I've listened to in the last few months, the issues around the pay inequalities and iniquities are existing. Issues around lack of career progression, lack of clear pathways, lack of practice, the adequate supplies and resources to really, where midwives have to dig into their pockets to really get to buy supplies and the like. I think there are things which we must really interrogate, self-interrogate. Governments need to interrogate. Donors, owners of health institutions, the international community needs to interrogate and ask ourselves, where have we placed midwives in all it?
You know, it's about supporting and investing, in the training, of these cadres. It's about supporting and investing in accreditation systems, where they may not exist, because ultimately we all want to make sure that high quality care is what is given and what is received. And so what standards, can we put in place to ensure that women are receiving high quality, respectful care? So the accreditation can now lead to conversations with government and policymakers around financing and making sure that there is ongoing revenue streams. So as Neha mentioned, it's not unfunded mandates and, unvalued work that is being done by midwives. We need to invest in advocacy groups, so this is something, we've done in Uganda in the past, so that there are opportunities for midwifery leadership, in, national conversations and in parliament. So, I think what I just like to leave the audience with is that these discussions are great and necessary, but what we need to do is invest in the solutions on ground and then make sure that those insights and perspectives and lessons from advancing those solutions, which may not be perfect, which, we may go 2 steps forward, 1 step back, but those lessons inform broader policy debates and hopefully acceleration, of the work that's happening at the front line.
So in Pakistan, we had, in terms of regulation and grades in the government, the midwife didn't have a grade. So the grade starts at the cleaner of the facility, and the midwife's grade was lower than that. And now I think for the first time in one province, the grade has gone up to a technician. And it went up, some of the midwives have been promoted to technicians. I mean, there's still a little bit wrong with that, but it happened because these midwives actually got up and they went to the regulatory body, and they just sat there and they spoke about their work, and they advocated until they got the regulation, the grade that they needed. And so one of the midwives I work with, she was telling me, she said, I'm really happy I've gotten a promotion, I've become a technician, but the work was done by midwives who actually advocated for themselves, and there is no other way, like no one else can do it except them.
The thing that comes to mind when we talk about greening midwifery is moving it to the community. Because when we move it outside of the highly technological, enormous hospital system, for those women for whom that's appropriate, midwifery in itself is a green practice. I mean, when you think about how much plastic we use, how much waste we cause when we actively manage pregnancy, childbirth, and postpartum, in those cases where that management isn't necessary, that's an enormous just way to change things. So opening up midwifery-led units, in institutions, opening up freestanding midwifery centers or birth centers, and increasing the scope of practice for midwives so that they can work in out-of-hospital settings that include home birth. Those are all practices that can really contribute to greening.
Because what I've learned over my 17 years of working is that until you realize that the power lies within you and you have to really grab and know that you have your rights and you have the power to really demand those rights for you to really be able to be grant, no one will ever grant that to you. So I think it's about ensuring that we really, in our trainings, to ensure that midwives realize that they are not lesser profession, that they have the power and they have what it takes to really stand up and speak up for their profession. And when they do that, they will be actually pushing and advocating for mothers.
But I really want to, on behalf of our extraordinary numbers of audience, to say thank you, Marianne, thank you, Neha, thank you, Daniela, thank you, Angela. You've been amazing. You have made the case for the Push campaign through your wisdom, your expertise, your courage and your vision. You absolutely demonstrate why this campaign is just so essential. And over the next 10 years, it is the Push campaign that is going to take back that power. And taking back that power, wield it for the purposes and in the direction to the quality and in the response to sustainable responses to crises that you've all said can be achieved with the political will, with the commitment, with the engagement of communities and with investment.
Now more than ever is the time to invest in our future. Now is the time to invest in the long term. Now is the time to invest in quality and respectful care. And so now is the time to invest in communities. So time to push for midwives. We need to stop talking midwifery. We need to start doing midwifery. And it needs a paradigm shift. Our panelists have reiterated this. So it's not we should be carrying on with what we've been doing. No, it needs a change. And yes, of course, all healthcare workers in the team are important. Yet the evidence shows that midwives have a key role. And so I dare all of us to genuinely push for midwives. Midwives won't push away others. We are team workers. But we need to be there to lead the philosophy of care. So we really need to push for midwives. And we need to face the patriarchal power dynamics that are still continuing to marginalize midwives. We hope that individuals and organizations will join the global push for midwives, and that sexual reproductive health and rights is a human right, that we accept that, and that access to a midwife is therefore a human right, and so support for midwives to do what they are doing is a human right. And yes, we have a long way to go, but every single person attending today can play their part in this campaign, and it can become a huge global push for midwives movement. We have 10 years and we can really do this.